Hi, I'm Dr. Daniela Stein. I'm a medical doctor and I'm an international best-selling author with my book Thrive Through Menopause. In my book, I have a whole chapter dedicated to sex and menopause. The reason is 70% of women do experience sexual symptoms during menopause. So this is quite empowering to know that you can have good sex during and after menopause. There are things that have to change and some lifestyle changes that you can implement to help you to enjoy sex. So first of all, sexual intercourse should not hurt. If it hurts, go and see your doctor. Make sure there's nothing wrong. There's a couple of things which my patients typically experience. So I have a big wellness clinic and I see a lot of perimenopausal women. I'm in Canada, and then so we typically make sure that I do a proper vaginal exam to make sure there's nothing that looks wrong. Women must still get their pap smears. We must always first make sure that there's nothing big that's wrong. But then something that I very commonly see is that women would leak some urine because of less estrogen towards the vaginal area. Women would often, their vaginal skin would be much thinner. Bladder could prolapse a bit, or rectum can prolapse a bit, causing incontinence. So that is quite important to go to a healthcare provider to have that checked out. Something else I see quite a bit during menopause is that women, their skin really thins because of the less estrogen. That causes more common bladder infections. If you are experiencing more often bladder infections, hormone therapy, a local estrogen therapy, is very good for that. I typically don't start off with hormone therapy in most of my patients. I start with lifestyle changes. But specifically we call it vaginal atrophy, but thinning of the vaginal skin after menopause due to a lack of estrogen, I do give women estrogen. That estrogen that we give vaginally typically don't get absorbed into your body, so that specific preparation won't help for hot flushes or other symptoms, but it helps to increase the thickness of the vaginal skin just locally. So I use it for women that has even my patients that I see in hospital. I have patients in hospital that are 100 years old or 98 years old. When they come at an older age, even if they don't have menopausal symptoms, if their main symptom is that they get bladder infections often, and these bladder infections can make you very sick because it can spread to your whole body, then what we really do is to give them a vaginal suppository or cream to thicken that vaginal skin to help to prevent vaginal infections, prevent urinary tract infections. It could be really a game changer if you get urinary tract infections often. And that more goes into UTIs, urinary tract infections, and I have a whole chapter in the book on urinary tract infections as well. So I'll maybe cover both chapters here, the sex part and the UTI part. So for UTI, bladder prolapse, bladder infections, it's important to try to see a pelvic health therapist if you have access to one. They do an internal exam, see if there's prolapse, and will teach you exercises that you can do. And you can look it up, exercises to help with Kegel exercises is the most common one that you can Google to help you, things that you can do at home for free to help you strengthen your pelvic muscles. So and some people need surgery, so have it checked out. That's a big thing. So if you've seen your doctor, you don't have prolapse, you're not leaking urine, you're not getting bladder infections. Next thing about sex is to use lubrication. Your body's not going to secrete as much lubrication as it used to. So make sure you use vaginal lubrication. And I typically advise that you can use coconut oil. You don't have to buy expensive products. Just make sure it's a very good, clean coconut oil that you're using. It's usually the safest, cleanest thing to use, that just to make sure you have that extra lubrication. Then, very important to chat with your partner. Things change. Things that you enjoyed, that you found romantic in your 20s, are not the same things that you find romantic in your 40s, 50s, 60s. It is sometimes harder to have sex if you're in a house bed is not made, there's a dog in the bed, there's different things on your plate. So really to talk to your partner about the things around menopause. What lights your candles? What are the things that you find erotic and that you enjoy? So that's very important. It's really a growth as you grow in your relationship, and it's important to have that ongoing conversation with your partner about things you enjoy, things you don't enjoy. If the problem is purely not fixable through other things, if you feel maybe your biggest concern is, so for painful intercourse, you're going to make sure medically there's nothing wrong. You're going to use lubrication. You're going to use estrogen to thicken the skin. But if you feel that your libido itself does need something, I typically start with lifestyle measures. Are you sleeping enough? Are you getting joy from life? Are you exercising? Are you eating? Are you stressed out? What are you doing for relaxation? But many patients still say yes, they just want to get a supplement to increase their libido. There are supplements, and I have all the supplements listed in my book, but there are supplements that you can take that have science behind it that's proven to increase your libido that you might find very useful. The good news is you can have an amazing sexual life. You can have a satisfying sexual life during and after menopause. You might need to tweak a couple of things. You might need to change a couple of things, but you can still enjoy a very satisfying sexual life. Read that chapter on sex in my book, Thrive Through Menopause, and watch my next video where I'm going to talk about the next topic, which is wellness in the workplace during menopause. So that's a big thing, and it's a big jump from sex to work. But the next one is, watch the next video. You'll find it very helpful. Take care.